Hello everyone, welcome to Nursing Arena. My name is Kritika Andora and today we are going to discuss some of the important questions of Fundamental of Nursing and Medical Surgical Nursing. Please don't forget to like and subscribe our channel. Let's get started. First question. The name of the nursing diagnosis is linked to the etiology with the phrase as manifested by, related to, evidenced by, or due to. So, the correct answer, the name of the nursing diagnosis is linked to the etiology with the phrase related to. For example, risk for impaired skin integrity related to surgery. Next question. The process in which a nasogastric tube is inserted, the stomach is flushed and ingested substances are removed through the tube is called colonic irrigation, gastric lavage, decompensation or gastric gavage. So, the correct answer, the process in which a nasogastric tube is inserted, the stomach is flushed and ingested substances are removed through the tube is called gastric lavage. Gastric lavage is used frequently in the emergency treatment of upper GI hemorrhage, toxins ingestion, etc. Lavage means washing out of gastric and intestinal cavity. Next question. A nurse is doing endotracheal suctioning. During the procedure, the nurse notes decreasing heart rate on the monitor. What should be the first priority action? Continue to suction, stop the procedure and reoxygenate the patient, ensure that suction is limited to 15 seconds, or notify the physician immediately. So, the correct answer, the first priority action of the nurse is to stop the procedure and reoxygenate the patient. This is because suctioning can in fact stimulate the vagus nerve, that is 10th cranial nerve, which in turn slow the heart rate and cause blood pressure to drop. Next question. Which of the following diseases are the autoimmune disease? Spondylitis, hemophilia, myasthenia gravis, or Parkinson's disease? So, the correct answer, the autoimmune disease is the myasthenia gravis. Myasthenia gravis is caused by an error in the transmission of nerve impulses to muscles. And an autoimmune disease means a disease in which the body's immune system attacks healthy cells. Next question. A patient is suspected of having a myocardial infarction. The nurse assesses for elevations in which of the following isoenzyme values reported with the creatinine kinase level? MB, BB, MM, or MK? So, the correct answer for this is MB. Now, what are isoenzymes? Isoenzymes are enzymes that differ in amino acid sequence but catalyze the same chemical reaction. Now, what are creatine kinase? Creatine kinase is a dimer consisting of two peptides, B for brain and M for muscles, which make up the three isoenzyme CK1, that is BB, CK2, MB, and CK3, that is MM. Next question. When examining a patient who is paralyzed below the T4 level, the medical surgical nurse expects to find impaired diaphragmatic function requiring ventilator support, flaccidity of the upper extremities, independent use of the upper extremities and efficient cuff, or hyperreflexia and spasticity of the upper extremities. So, the correct answer for this is independent use of the upper extremities and efficient cuff. Next question. The art of applying mock injuries for the purpose of training emergency response team and other medical personnel is called exhibit, specimen, moulage, or model. So, the correct answer, the art of applying mock injuries for the purpose of training emergency response team and other medical personnel is called moulage. Next question. The nurse should hold the syringe almost flat against the patient's skin at about a 15-degree angle with the bevel up while administering a intramuscular injection, intradermal injection, intrathecal injection, or subcutaneous injection. So, the correct answer is intradermal injection. It is because dermis is the second layer of the skin, and for introducing medicine into the dermis, we have to make an angle of 15 degree. Next question. Which blood group can be administered to a patient in emergency when his blood group is not known? O positive, AB positive, AB negative, or O negative? So, the correct answer, the blood group which can be administered to a patient in emergency is O negative, because O negative is a universal blood donor. Next question. Cystic fibrosis is an example of autosomal recessive disorder, X-linked dominant disorder, autosomal dominant disorder, or X-linked recessive disorder. So, the correct answer, cystic fibrosis is an example of autosomal recessive disorder. Cystic fibrosis is that because not inherited solely from the mother or father, as in sex-linked disorders. That's why it is an autosomal recessive disorder. Next question. A patient with diabetes mellitus has glycosylated hemoglobin A1C level of 9%. Based on this result, the nurse plans to teach the client about the need to prevent and recognize hypoglycemia, avoid infection, take in adequate fluids, or prevent and recognize hyperglycemia. So, the correct answer, patient with diabetes mellitus has glycosylated hemoglobin level of 9%. The nurse needs to prevent and recognize hyperglycemia. Next question. On physical examination, the nurse notes that there is separation of layers of a surgical wound. She records it as evisceration, herniation, prolapse, or dehiscence. So, the correct answer, separation of layers of surgical wound is dehiscence. Next question. The act of deliberately ending a person's life to relieve suffering is called tort, libel, euthanasia, or suicide. So, the correct answer, the act of deliberately ending a person's life to relieve suffering is called euthanasia. Next question. Which of the following tubes is used to manage upper gastrointestinal hemorrhage due to esophageal varices? Jackson-Parr drain, Sgpg tube, T-tube or Penrose drain? So, the correct answer, tube which is used to manage upper GI hemorrhage due to esophageal varices is Sgpg tube. Next question. Which of the following drugs is the antidote for magnesium toxicity? Calcium gluconate, vitamin K, naloxone or hydralazine? So, the correct answer, antidote for magnesium toxicity is calcium gluconate. Calcium helps to regulate the normal release and storage of neurotransmitters. It also reduces the amount of magnesium in the body. Next question. The nurse, recognizing that digitalis preparations promote diuresis, should evaluate patients for a depletion of phosphate, calcium, sodium or potassium. So, the correct answer is potassium. There is a depletion of potassium. Next question. Pain in calf or on dorsiflexion of the foot, Homan sign may indicate thrombophlebitis, aneurysm, lymphedema or cellulitis. So, the correct answer is thrombophlebitis. Thrombophlebitis is an inflammatory process that causes a blood clot to form and block one or more veins, usually in legs. Next question. A client is suffering from diabetes mellitus. Which one of the following symptoms indicate hyperglycemia? Diaphoresis, dizziness, hunger, headache, blood vision, nausea, polyuria, polydipsia or polyphagia, oliguria, fluid retention or shortness of breath. So, the correct answer, symptoms which indicate hyperglycemia are polyuria, polydipsia or polyphagia. Polyuria means excessive urine, polydipsia means excessive thirst and polyphagia means excessive hunger. These are the cardinal signs of diabetes mellitus. Next question. A patient with renal failure having edema is most likely to receive laxative, beta blockers, antidiuretics or diuretics. So, the correct answer, patient with renal failure having edema is most likely to receive diuretics. Diuretics are also called as water pills. These are the medications designed to increase the amount of water and salt expelled from the body as urine. Next question. Evisceration refers to separation of wound edges, eruption of bowel through surgical site, healing of surgical site or darkening of wound edges. So, the correct answer, evisceration refers to eruption of bowel through surgical site. Next question. Which of the following statement about acid-base balance is incorrect? Hyperventilation causes respiratory alkalosis. Overuse of antacids causes metabolic acidosis. Hypoventilation causes respiratory acidosis, or loss of gastric juices causes metabolic alkalosis. So, the correct answer, statement about acid-base balance is incorrect, is overuse of antacids cause metabolic acidosis. This is because antacids are a class of medicine that neutralize acid in the stomach to make pH more neutral. Next question. Incidence is defined as number of new cases occurring during a specific period, number of old cases present, number of cases existing in a given population at a given moment, number of cases existing in a given period. So, the correct answer, incidence is defined as number of new cases occurring during a specific period. Next question. Hypertonicity and scissoring leg movements area expected clinical findings in autism, cerebral palsy, mental retardation, or schizophrenia. So, the correct answer, hypertonicity and scissoring leg movements area are expected clinical findings in cerebral palsy. Cerebral palsy is caused by an brain injury or problem that occurs during pregnancy or during birth of the child or with 2 to 3 years of child life. Hypertonicity means muscles overactivity. Next question. The nurse administers heparin BD subcutaneously for a patient in cardiogenic shock. The drug is expected to exhibit dash action: anticoagulant, antidysrhythmic, inotrope, or vasopressor. So, the correct answer is anticoagulant, because heparin is a anticoagulant. Next question. A dash is an elevation of skin filled with fluid and is less than 1 cm in diameter. Vehicle, vesicle, papule, or macule. So, the correct answer is a vesicle is an elevation of skin filled with fluid and is less than 1 cm in diameter. Next question. Tall tented T waves and widened QRS are seen in hyperphosphatemia, hyperkalemia, hyponatremia, or hyperglycemia. So, the correct answer, tall tented T waves and widened QRS are seen in hyperphosphatemia. This was due to an uncommon cause. Next question. Which of the following is a stage of the nursing process in which a nurse continuously collects data to identify a patient's actual and potential health needs? Planning, evaluation, implementation, or assessment? So, the correct answer, the stage of the nursing process in which the nurse continuously collects data to identify a patient's actual and potential health needs is assessment. Next question. cracked pot sounds elicited while skull percussion indicative of increased intracranial tension is known as Hohmann sign, Romberg sign, Peroneal sign, or McQueen sign. So, the correct answer, cracked pot sounds elicited while skull percussion indicative of increased intracranial tension is known as McQueen sign. Next question. Which of the following considered as an indication for administrating serum albumin? Formation of WBCs, maintenance of oncotic pressure, formation of RBCs, or clotting of blood. So, the correct answer is maintenance of oncotic pressure. Serum albumin or serum is a protein found in blood plasma that helps maintaining the blood pressure. Due to the colloidal nature of the albumin and to a lesser extent of other blood proteins called globulins, keep the fluid within the blood vessels and hence maintain the oncotic pressure. Next question. In ECG, the P wave represents atrial depolarization, ventricular depolarization, ventricular repolarization, or atrial repolarization. So, the correct answer, in ECG, the P wave represents atrial depolarization. Next question. Bleeding precautions like needle stick injury prevention should be followed in all of the following cases except when the patients are on cephalosporin, suffering from hemophilia, suffering from liver disease, or on anticoagulants. So, the correct answer, bleeding precautions like needle stick injury prevention should be followed in all of the following cases except on cephalosporin, because cephalosporins are the group of B-lactam antibiotics. And if a patient is suffering from hemophilia, that means he or she has absence of some clotting factors. And if suffering from liver disease, that means the liver is responsible for producing most of the coagulation factors. And if the patient is on anticoagulants like heparin or warfarin, they help in dissolving the blood clots or make blood thin. Next question. Which of the following organs is affected in gastroesophageal reflux disease? GERD. Duodenum, lower esophageal sphincter, diaphragm, or pylorus. So, the correct answer, organ which is affected in GERD is lower esophageal sphincter, because the lower esophageal sphincter relaxes to allow food and liquid to flow into your stomach. Then sphincter closes again. But in GERD, the lower sphincter abnormally relaxes or weakens, so the acid flow back to esophagus. Next question. The first action in case of a blood transfusion reaction is waiting for the symptoms to subside, stopping the blood, informing a physician, or maintaining the line with normal saline. So, the correct answer, the first action in case of blood transfusion reaction is stopping the blood. Next question. Sharing responsibility and authority with others and holding them accountable for performance is termed as dash. Leading, organizing, controlling, or delegation. So, the correct answer, sharing responsibility and authority with others and holding them accountable for performance is termed as delegation. Next question. Which is not included in ethical principle? Justice, maleficence, autonomy, or non-maleficence? So, the correct answer, not included in ethical principle, is maleficence. Maleficence is the act of committing harm or evil. Next question. When performing an abdominal assessment, in which order are the given steps followed? A. Inspection, auscultation, percussion, or palpation. B. Palpation, inspection, percussion, auscultation. C. Percussion, auscultation, inspection, palpation. Or D. Inspection, percussion, palpation, or auscultation. So, the correct answer, during an abdominal assessment, the order which are to be followed are inspection, auscultation, percussion, or palpation. Auscultation of the abdomen should be performed prior to percussion and palpation because as physical manipulation of the abdomen may induce a change in bowel sounds. Next question. Intravenous heparin therapy is ordered for a patient. While implementing this order, a nurse should ensure the availability of which of the following medications in the nursing unit? Potassium chloride, protamine sulfate, aminocaproic acid, or vitamin K. So, the correct answer, during intravenous heparin therapy, the nurse should ensure the availability of protamine sulfate. Protamine sulfate is a medication that is used to reverse the effects of heparin or heparin overdose. It is given by injection into a vein. Next question. Infection that occurs as a result of a therapeutic or diagnostic procedure is called an opportunistic infection, iatrogenic infection, cross infection, or nosocomial infection. So, the correct answer, infection that occurs as a result of therapeutic or diagnostic procedure is called iatrogenic infection. Next question. Which of the following routes are not transmission of HIV? Needle prick, parenteral route, blood transfusion, or safe for blood and fluid? So, the correct answer, the following route are not transmission of HIV is safe for blood and fluid. Next question. C for vertebrae damage cause following symptoms: flaccid bladder, hypertension, respiratory symptoms, or hyperactive bowel. So, the correct answer, C for vertebrae damage cause respiratory symptoms. Because an injury at C4 or higher will affect the diaphragm, the muscle that moves the lungs for breathing. Next question. Which of the following conditions are abnormal in mouth? Dry mouth and dry lips, moist tongue, moist lips, or moist mouth? So, the condition which is abnormal in mouth is dry mouth and dry lips. Because dry mouth can be due to certain health conditions such as diabetes, stroke, yeast infections, or oral thrush in mouth, etc. Next question. Atrial blood pH is 7.2, 7.4, 7.3 or 7.8. So, the correct answer, atrial blood pH is 7.4. Next question. Do not harm is which ethical principle? Veracity, beneficence, non-maleficence, or justice? So, the correct answer, do not harm is non-maleficence. Next question. Foot drop is caused by following nerve damage: tibial nerve, femoral nerve, deep peroneal nerve, or malleus nerve. So, the correct answer, foot drop is caused by the deep peroneal nerve damage. Because entrapment of the common peroneal nerve, also called as fibular nerve, can cause a myriad of symptoms ranging from low back pain to foot drop. Next question. Carpal tunnel syndrome occurs due to compressed of following nerve: brachial plexus, motor fibers of radial nerve, sensory fibers, or median nerve. So, the correct answer, carpal tunnel syndrome are caused due to compression of median nerve. Next question. Right hemisphere damage which is not included: left hemiplegia, left hemiparesis, right hemiplegia, or weakness in left side of body. So, right hemisphere damage which is not included is right hemiplegia. It is because the crossing over of the upper motor neurons to the opposite side along their course that the right hemisphere controls the left side of the body and the left hemisphere controls the right side of the body. This crossing over is known as decussation. Next question. Age-related hearing loss is presbycusis, SHL, CHL, or presbyopia. So, the correct answer, age-related hearing loss is presbycusis. Next question. Decreased oxygen in blood is called hypoxia, apnea, cyanosis, or hypoxemia. So, the correct answer, decreased oxygen in blood is called hypoxemia. Next question. Anosmia means loss of speech, loss of sense of smell, loss of movement, or inability to perform particular action. So, the correct answer, anosmia means loss of sense of smell. Next question. Serum hepatitis, also known as hepatitis A, hepatitis B, hepatitis C, or hepatitis D. So, the correct answer, serum hepatitis is also called as hepatitis B. Next question. Which hepatitis are transferred through institutional and health organization? Hepatitis D, hepatitis C, hepatitis B, or hepatitis A? So, the correct answer, hepatitis which transferred through institutional and health organization is hepatitis A. Hepatitis A is usually transferred from fecal-oral route or through infected person. Next question. Strives to maintain a balance between biological, psychological, and social and need-client adaptive response to environment is described by Jean Watson, Callista Roy adaptation model, Martha Rogers, or Virginia Henderson. So, the correct answer, strives to maintain a balance between biological, psychological, and social need-client adaptive response to environment is described by Callista Roy adaptation model. Next question. Which of the following is not symptoms of increased ICP? Clear consciousness, headache, irritability, or vomiting? So, the correct answer, the symptoms of increased ICP, which is not a symptom, is clear consciousness. Next question. Peripheral vision loss in cataract, retinal detachment, closure angle, or open angle glaucoma? So, the correct answer, peripheral vision loss is open angle glaucoma. Next question. Capnography is measures carbon monoxide, nitrogen, carbon dioxide, or hydrogen. So, capnography is measures carbon dioxide. Next question. Hemorrhagic disease of the newborn is caused by the deficiency of which vitamin? Vitamin D, vitamin A, vitamin K, or vitamin C? So, the correct answer, hemorrhagic disease of the newborn is caused by the deficiency of vitamin K. Vitamin K prevents bleeding and helps in blood clotting. Next question. A nurse is conducting a dietary assessment of a patient who is on a vegan diet, that is vegetarian diet. The nurse should plan to provide dietary teaching focused on food items high in which vitamin that may be absent in a vegan diet? Vitamin A, vitamin B12, vitamin C, or vitamin E? So, correct answer, food items high in which vitamin, which may absent in a vegan diet, is vitamin B12. Vitamin B12 is naturally found in animal products, including fish, meat, poultry, eggs, milk, and milk products. Next question. A nurse is reviewing a patient's records and notes that the patient has renal disorder. The nurse expects to note which of the following laboratory results: decreased serum potassium level, decreased serum phosphate level, elevated serum creatinine level, or increased hemoglobin level. So, the correct answer, the nurse expects to note elevated serum creatinine level. This is because as the kidney become impaired for any reasons, the creatinine level in the blood will rise due to poor clearance of creatinine by the kidneys. Next question. Kaiser-Fleischer golden brown ring at the limbus of the cornea seen with the hand lens is observed in Down syndrome, cataract, glaucoma, or Wilson's disease. So, the correct answer, Kaiser-Fleischer golden brown ring at the limbus of the cornea seen with the hand lens is observed in Wilson's disease. Next question. Billroth first and Billroth second are surgical procedures done for gastric cancer, pancreatic cancer, breast cancer, or lung cancer. So, the correct answer, Billroth first and Billroth second are surgical procedures done for gastric cancer. Billroth first is the creation of an anastomosis between the duodenum and gastric remnant. Billroth second is constructed by sewing a loop of jejunum to the gastric remnant. Next question. Ophthalmic medication should be instilled at lower conjunctival sac, the cornea of the eye, upper conjunctival sac, or the edge of the eye. So, the correct answer, ophthalmic medication should be instilled at lower conjunctival sac. This is for better absorption. Next question. The four meta-paradigms of nursing theory are person, health, environment, and nursing. Person, health, communication, and nursing. Person, wellness, security, and nursing, or nursing, health, communication, and person. So, the correct answer, the four meta-paradigms of nursing theory are person, health, environment, and nursing. Next question. McBurney's point of tenderness is present in acute appendicitis, acute tonsillitis, acute cholecystitis, or acute gastritis. So, the correct answer, McBurney's point of tenderness is present in acute appendicitis. Next question. Brush-field spots, protruded tongue, and single palmar crease are characteristic features of Down syndrome, Edwards syndrome, Patau syndrome, or Turner syndrome. So, brush-field spots, protruded tongue, and single palmar crease are characteristic features of Down syndrome. Next question. Reed-Sternberg cells in node are found in multiple myeloma, Hodgkin's lymphoma, non-Hodgkin's lymphoma, or leukemia. So, the correct answer, Reed-Sternberg cells in nodes are found in Hodgkin's lymphoma. Reed-Sternberg cells, also known as lacunar histiocytes for certain types, are distinctive giant cells found with light microscopy in biopsies from individuals with Hodgkin's lymphoma. Next question. Exaggerated convexity in thoracic region is called kyphosis, lordosis, myelitis, or scoliosis. So, the correct answer, exaggerated convexity in thoracic region is called kyphosis. Next question. Compression to ventilation ratio in adults with 2 rescuers is 3:1, 30:1, 30:2, 15:2, or 15:1. So, the correct answer, compression to ventilation ratio in adults with 2 rescuers is 15:2. Next question. An intrathecal injection administers a drug through the superficial vein, knee, cardiac area, or spine. So, the correct answer, an intrathecal injection administers a drug through the spine. Next question. How many movements of hand hygiene have been laid down by WHO? 7, 8, 6, or 5? So, movements of hand hygiene have been laid down by WHO are 5. Next question. Which of the following is the principal mode of heat exchange in an incubator? Radiation, conduction, evaporation, or convection? So, the correct answer, the following is the principal mode of heat exchange in an incubator is convection. Convection is the transfer of heat by the movement of a fluid between areas of different temperature. Next question. Which of the following is the method for managing foreign body airway obstruction? Jaw thrust maneuver, Helmholtz maneuver, Epley maneuver, or Valsalva maneuver? So, the correct answer, the method for managing foreign body airway obstruction is Helmholtz maneuver. Helmholtz maneuver is a first aid procedure for dislodging an obstructive from a person's windpipe, in which a sudden strong pressure is applied on their abdomen between the navel and rib cage. Next question. Which of the following combinations of adverse effects must be carefully monitored when administering IV insulin to a patient diagnosed with diabetic ketoacidosis? Hypercalcemia and hypernatremia, hypokalemia and hypoglycemia, hypokalemia and hypophonatremia, or hyperkalemia or hyperglycemia? So, the correct answer for that is hypokalemia and hypoglycemia. This is because exogenous insulin can induce mild hypokalemia because it promotes the entry of potassium into skeletal muscles and hepatic cells, by increasing the activity of the sodium-potassium ATPase pump. The increased secretion of epinephrine due to insulin-induced hypoglycemia may also produce a contributory role. Next question. Normal respiration is also called apnea, orthopnea, eupnea, or dyspnea. The correct answer, normal respiration is also called as eupnea. Next question. Painful spasm of the hamstring muscles and resistance to further extension of the leg at the knee while flexing the hip of a recumbent patient is called Karnik sign, Brudzinski sign, opisthotonus, or ankle clonus. So, the correct answer, painful spasm of the hamstring muscles and resistance to further extension of the leg at the knee while flexing the hip of a recumbent patient is called Karnik sign. Next question. Which of the following hepatitis viruses spread by fecal-oral route? Hepatitis D, hepatitis C, hepatitis A, or hepatitis B? So, the correct answer, hepatitis A, spread by fecal-oral route. Next question. Which of the following pathophysiological process is involved in multiple sclerosis? Destruction of the brainstem and basal ganglia in the brain, chronic inflammation of rhizomes just outside the central nervous system, degeneration of the nucleus pulposus causing pressure on the spinal cord, development of demyelination of the myelin sheath interfering with the nerve transmission. So, the correct answer, the pathophysiological process is involved in the multiple sclerosis is the development of demyelination of the myelin sheath interfering with the nerve transmission. Next question. Nurses Day is celebrated on April 1st, March 7th, May 12th, or December 1st. So, the correct answer, Nurses Day is celebrated on May 12th. Next question. Aneurysm means dilation of artery, vein, skin, or all. So, the correct answer, aneurysm means dilation of artery. Next question. The scale used to assess the level of consciousness in the patient, Hoare scale, Roberts scale, Glasgow coma scale, or none? The correct answer, the scale used to assess the level of consciousness in the patient is Glasgow coma scale. Next question. Patient treated in triage is vomiting, cardiac arrest, fever, or none? The correct answer, patient treated in triage is cardiac arrest. Next question. Specific gravity of the urine is A. 1.010, B. 1.001, C. 1.100, or D. 1.110. So, the correct answer, specific gravity of the urine is 1.010. Next question. Example of dry heat are except heating pad, sitz bath, diathermy or hot water bag. So the correct answer, example of dry heat are except sitz bath. Next question. Contraindication for nasogastric intubation: gastric surgery, polyps in nose, fractured jaw or ulcer. The correct answer, contraindication for nasogastric intubation is polyps in nose. Next question. Skills required for nurses are cognitive skill, psychomotor skill, technical skill, all of the above. The correct answer, skills required for nurses are all of the above. Next question. Legal importance is given to register, files, order sheets or records. The correct answer, legal importance is given to records. Next question. The temperature of the sponge bath should be 110 to 115 degree Fahrenheit, 90 to 95 degree Fahrenheit, 100 to 105 degree Fahrenheit or 100 degree Fahrenheit. The correct answer, the temperature of the sponge bath should be 90 to 95 degree Fahrenheit. Next question. During an ear irrigation in an adult, the earlobe position: lifted upwards and outwards, pulled downwards and forward, lifted upwards and backwards, pulled downwards and below. The correct answer, during an ear irrigation in an adult, the earlobe position should be lifted upwards and backwards. Next question. Positive sign of meningeal irritation: Kerning sign, opisthotonous position, knuckle rigidity, all of the above. The correct answer, positive sign of meningeal irritation is all of the above. Next question. Lupus erythematosus is an autoimmune disease, immune disease, self-disease or skin disease. So, the correct answer, lupus erythematosus is an autoimmune disease. It is an inflammatory disease caused when the immune system attacks its own tissues. Next question. CPR ratio, chest compression is to breathe is 30:2, 20:2, 15:3 or 20:3. So, the correct answer, CPR ratio chest compression is to breathe is 30:2. Next question. Removal of entire eye including sclera is enucleation, orthopics, evisceration or extenteration. So, the correct answer, removal of entire eye including sclera is exenteration. Enucleation is an intraocular tumor excision. Next question. Protrusion of stomach content into the thoracic cavity is called hernia, hiatal hernia, gastrohernia, or none? So, the correct answer, protrusion of stomach content into the thoracic cavity, is called hiatal hernia. Next question. MRI is contraindicated in patient is pacemaker, metal implant, brain tumor, or first or second answer, both. So, the correct answer, MRI is contraindicated in patient is first and second, that is pacemaker and metal implant. Next question. The Sgpg test is used to determine scarlet fever, diphtheria, tuberculosis, or typhoid. The correct answer, the Sgpg test is used to determine diphtheria. Next question. Systolic murmur associated with diminished second heartbeat is seen in aortic regurgitation, aortic stenosis, mitral regurgitation, or mitral stenosis. The correct answer, systolic murmur associated with diminished second heartbeat is seen in mitral regurgitation. Next question. DNR stands for do not respond, do not resuscitate, do not treat, or do not receive. So, the correct answer, DNR stands for do not resuscitate. Next question. The center for controlling body temperature is hypothalamus, medulla oblongata, hyponemia, or anemia. The correct answer, the center for controlling body temperature is hypothalamus. Next question. Insufficiency of oxygen in tissue is hypoxemia, hypoxia, hyponemia, or anemia. The correct answer, insufficiency of oxygen in tissue is hypoxia. Next question. Pus in urine is called polyuria, oliguria, pyuria, or anuria. The correct answer, pus in urine is called pyuria. Next question. A patient comes to emergency with breathless. What is the priority? Call the doctor, record the vital signs, provide oxygen mask, or registration. So, the correct answer, if a patient comes to emergency with breathless or breathlessness, the priority action of the nurse should be provide oxygen mask. Thank you everyone. Please don't forget to like and subscribe our channel.